at Turner syndrome and HRT, specifically how it impacts uterine growth.
Yeah, and we've got a great study to look at today. We've got both the research summary and the original study.
Oh, wow. So like straight from the source.
Exactly. And it's got some interesting, some surprising findings.
Yeah, the first thing that really jumped out at me was that women with TS who are using modern HRT actually have larger uteri than the control group.
Right.
And I was like, well, wait a second.
You'd think it'd be the opposite, right? That the women without TS, the control group, would naturally have larger uteri, but this study found the opposite.
So why is that so unexpected? Like, what makes this finding so surprising?
Well, previous research, especially research that was using older types of HRT, showed smaller uteri in women with TS.
Oh.
So this new research, which uses a specific kind of estrogen, it's called 17-beta estradiol. It's really like, changing the way we think about this.
Yeah.
And it shows how important it is to keep medical treatments updated, based on new research.
Right. Because what we knew 5-10 years ago is not necessarily what we know today.
Exactly.
Okay, so this is where I think it gets even more interesting for me. The study talks about using uterine size as a possible indicator of overall estrogen exposure.
Uh-huh.
Can you break that down a bit? What does that actually mean? And why is it so significant?
Okay, so uterine growth, it's heavily influenced by estrogen levels, right?
Mm-hmm.
So if we can measure the uterus, it gives doctors a non-invasive way to check if the HRT dose is appropriate. Because, everyone's body processes hormones a bit differently.
Right, that makes total sense.
So it's not like a one-size-fits-all kind of thing.
Right, and speaking of individual differences,
Yeah.
I noticed the study found that even when women with TS were on the same target dose of estrogen, their actual blood levels varied quite a bit.
Yeah.
Why would that be?
A few reasons. First, the way you take estrogen actually makes a difference. Some women use patches, some take pills, and that impacts how the body absorbs it, right?
Mm-hmm.
Then there's just individual differences in how we all metabolize hormones. Some people break them down faster, others slower. Kind of like, how some people can eat a ton and never gain weight.
Oh, yeah, like metabolism.
Metabolism. And even, something as simple as when the blood draw was taken, like relative to when a woman changed her patch or took her pill, can make a difference.
So many factors.
It's complex, yeah.
Okay, so let's say for a moment that modern HRT can lead to normal uterine development in women with TS.
Right.
What does that mean for them, practically speaking?
Well, smaller uteri in women with TS have historically been seen as a risk factor for pregnancy complications, right?
Mm-hmm.
So this study offers some hope that with modern HRT, those risks might actually be reduced. It's like we're giving the uterus the tools it needs to develop as it should. But it's important to remember that this study didn't directly look at pregnancy outcomes. So, we need more research to really understand the full implications.
So it's more about potential at this point than a guarantee.
Exactly.
Okay. And I also noticed this study didn't look at blood flow to the uterus.
Mm-hmm.
And that seems pretty important, for overall health and particularly for pregnancy.
Yeah, you're absolutely right. Blood flow is key.
It's like having a beautifully built house, but no plumbing. It's not going to function properly.
That's a great way to put it. Yeah, and it highlights why, we can't draw any really firm conclusions from just this one study alone.
Right.
It's an important piece of the puzzle, but not the whole picture.
For sure.
Yeah.
Okay. Moving on, the study found a correlation between endometrial thickness and uterine size in women with TS. Now, just to clarify for our listeners, the endometrium is the lining of the uterus, and it's super important for menstruation and pregnancy.
Right.
So why would those two things, the endometrial thickness and the overall size of the uterus, be connected?
Well, remember how we were talking about estrogen's influence on uterine growth?
Uh-huh.
Well, the endometrium is actually very sensitive to estrogen as well.
Okay.
So it's likely that in women with TS who are using HRT, the estrogen is kind of stimulating both things.
So it all comes back to estrogen.
It really does, yeah.
Okay, this is the part that really got me thinking. The study actually mentions that the optimal uterine size for carrying a pregnancy is unknown.
Mm-hmm.
So does that mean that we're kind of using uterine size as a marker without really fully understanding what it means?
That's a really great question, and it highlights how complex this whole area of medicine really is.
Yeah.
We know that, the uterus needs to grow and develop to a certain point to support a healthy pregnancy.
Right.
But we don't have a specific number, a magic number
Yeah.
for uterine size.
Yeah, like if it's this big, it's good. If it's this big, it's not good.
Right, exactly. So we're still learning, and this study, it's a really important step forward, but we need to be cautious about jumping to conclusions.
For sure. Oh, and before we move on, I have to mention this. The study found that BMI was negatively correlated with uterine volume in women with TS.
Oh, wow.
So that means a higher BMI was linked to a smaller uterine volume.
Huh. That's interesting.
Yeah, and it seems counterintuitive. Like, shouldn't it be the other way around?
Yeah, you would think so. It could have to do with how estrogen is metabolized differently in people with different BMIs, or there might be some other hormonal things going on, some other physiological factors we don't really know.
So another mystery.
Another mystery. Yeah, which is what makes research so exciting.
It really is. My brain is like doing a little dance right now. I'm so curious. There's just so much to unpack here. But for now, we're going to take a short pause. And when we come back, we'll dive into how the researchers actually measured uterine growth, and we'll talk about some of the other individual characteristics they looked at, like karyotype and growth hormone exposure. So stay tuned.
Welcome back. Before the break, we were talking about some of those really unexpected findings, like that link between BMI and uterine size.
Yeah, I'm still thinking about that one.
Me too. But let's shift gears a bit and talk about how they actually measured uterine growth in this study.
Okay, because I'm guessing they weren't just using a tape measure or something?
Nope, definitely not. They use something called pelvic ultrasonography.
Okay.
It's basically a type of imaging that uses sound waves to create pictures of the inside of the pelvis.
Oh, so it's like the same technology they used during pregnancy to see the baby?
Exactly. It's safe, non-invasive, and it lets them see exactly what's going on in there.
Very cool. So they're getting a clear picture of the uterus.
Yeah, and they took very specific measurements too, not just a general look. They measured the length, the diameter, and the dimensions at both the top and bottom of the uterus.
Whoa, so they really went all out. Why so many different measurements?
Well, all those measurements allowed them to calculate both the size and the shape of the uterus.
Okay.
They even measured something called the fundal cervical ratio.
The what?
The fundal cervical ratio, or FCR. Think of it like, it tells us if the uterus has the right proportions to support a pregnancy.
Okay, so it's not just about size, it's about shape too.
Right, exactly. And in this study, most of the women with TS who were on modern HRT, they actually had a healthy FCR.
Oh, that's good. So it sounds like modern HRT is helping the uterus to actually develop in a way that could support a pregnancy.
That's the hope. And it's also important to point out that they did these ultrasound measurements in a really standardized way.
Okay.
Like the images were even reviewed by a specialist to make sure everything was accurate.
So we can trust the data.
Absolutely. But the physical measurements were only part of the story. They also gathered a lot of other information on each of the women with TS.
Like what kind of information?
Things like their karyotype, which is basically a picture of their chromosomes.
Oh, wow.
It helps to see if there are any genetic variations within TS that might be linked to uterine size.
So they're looking at the genetic level.
Yeah, because TS is a really complex condition, and there's a whole range of genetic presentations.
Right, and that can impact how someone responds to treatment, right?
Absolutely. It's all about personalized care. They also gathered information about growth hormone exposure,
Okay.
because a lot of girls with TS receive growth hormone therapy to help them reach a normal height, and they wanted to see if that might also have an impact on uterine development.
So they're trying to see how all these different treatments might interact.
Exactly. And of course, they documented each woman's HRT regimen in detail, like when they started taking estrogen, the dose, whether they used patches or pills, and their history of progesterone use.
So basically all the nitty-gritty details.
Yep, all the details.
Mhm.
Because it all helps to paint a more complete picture of how all these different factors, both genetic and environmental, might be influencing uterine growth in women with TS.
Wow, it sounds like they were incredibly thorough.
Yeah, they really were. And that's what makes this study so strong. Like, the data they collected is really valuable. It lays the groundwork for future studies, and it could even help doctors to develop more individualized HRT approaches.
That's so cool. It's like each study builds on the last one, and we keep getting closer to a deeper understanding.
I know, it's really exciting. And speaking of individual details, they actually found some interesting differences based on how the women were taking their estrogen.
Oh, really?
Yeah, so the women who were using transdermal estradiol, the kind you get through a patch, they tended to have slightly larger uteri compared to those taking oral estradiol.
Huh. Why would that be? Is one method better than the other?
It's not really about being better or worse. It's more about how the body processes the estrogen.
Huh.
So when you use a patch, the estrogen bypasses the liver, and that means it might not be broken down as quickly.
Odd.
So you might end up with higher levels of estrogen circulating in the body, and that could lead to more uterine growth.
That makes sense, but we need more research to say for sure, right?
Right. Yeah, we definitely need more research to confirm that. It's just an interesting observation for now.
Okay, so it sounds like both methods have their pros and cons.
Right, exactly. The best way to take HRT really depends on the individual and their specific needs.
Makes sense. Okay, so we've covered a lot of ground here. What are the key takeaways from all this? What should our listeners be walking away with?
I think the main takeaway is that modern HRT, especially those regimens that use 17-beta estradiol, they seem to be really effective at promoting healthy uterine growth in women with TS.
Hmm.
And this could have a huge impact on their reproductive health. And, it could offer some real hope for reducing those pregnancy-related risks we talked about.
That's like a whole new chapter is opening up for women with TS. They have more options and more control over their reproductive future.
Absolutely. But it's really important to remember that research is ongoing. We still have questions to answer, and we need more studies to really solidify these findings and understand the long-term effects.
It's a journey.
It is, and it really highlights how important it is for women with TS to stay informed about the latest research, to ask questions, and have those open conversations with their healthcare providers.
Because it's about making the best decisions for each individual person.
Exactly. And speaking of discoveries, there's still more to uncover from this study. So when we come back, we're going to shift our focus to the relationship between uterine growth and other factors, like the presence of ovaries and something called endometrial thickness. Stay tuned.
All right, so we're back, and we've been talking about all these different factors that could influence uterine growth in women with TS. But there's one more. I'm curious about the presence of ovaries.
Right.
So I know that most women with TS have underdeveloped or even missing ovaries, but this study included some women who still had at least one ovary.
Mm-hmm.
Did the researchers find any connection between like ovarian volume and uterine size?
Yeah, they definitely looked into that. And it
Mm.
turns out about half of the women in the study with TS actually had visible ovaries.
Yeah.
But here's the interesting thing. They didn't find a strong link between the size of those ovaries and the size of the uterus.
So even if a woman with TS has ovaries, it doesn't necessarily mean she'll have a larger uterus.
That's what the data seems to suggest, yeah.
Interesting.
It really seems to point to HRT, particularly estrogen replacement, as the main driver of uterine growth.
Okay.
Which makes sense, right? Because in women without TS, the ovaries are the primary source of estrogen.
Right.
But in women with TS, HRT kind of steps in to fill that role.
So it's like HRT is mimicking what the ovaries would normally do.
Exactly. And I think this finding really reinforces the idea that modern HRT is just crucial for normal uterine development in women with TS, whether they have ovaries or not.
Wow, yeah, it really highlights how important HRT is in this context.
Absolutely.
As we're wrapping up this deep dive, I have to say I'm walking away with so much more knowledge about this whole topic.
Yeah.
But like any good deep